Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
It's just very tight in the mid back section. Especially if I'm trying to play tennis or golf.
Twisting?
Yeah, the twisting.
The twisting motion aggravated. Okay. So how long this been going on?
Gosh, probably on and off for about 20 years.
20 years. Do you remember any mechanism of injury or just happened randomly?
No injury. Probably just more occupational hazard.
Okay. So for 20 years, how much pain do you feel from 0 to 10 at worst?
Probably the worst that's ever been, maybe about like a 6 or 7.
So for the last 20 years, what kind of treatment have you received for this?
Oh gosh, I've tried everything. I've tried physical therapy.
Okay.
I've tried acupuncture, massage, chiropractic.
Okay.
About the only thing I haven't done is surgery.
No
Which I
comment.
don't want to do. I don't want to do any surgery.
Well, you have a muscle tightness, so we try to address it non-invasively.
Okay.
Yeah. So you tried everything. Okay. You're very tight. Let's mark on your leg how much you can go. Touch your legs. So you're missing like quarter of your length there.
I mean, I could go farther, but it's
very tight. Very tight.
Yes.
Okay. Let's extend back. That's very stiff.
That's really tight.
0 to 10, how much?
It's about a 6.
6. Okay.
Yeah.
All right. So let's do twisting left and right. So range of motion twisting wise is okay, but you're very limited with extension. Very limited. Let's do side bend left and right.
That's probably worse than twisting as far as mobility, I think.
Side bend.
Yeah.
So how much tightness from 0 to 10?
It's probably about a 5.
5. Okay. And the mid back. Yeah. And extension, how much?
Maybe about 3 or 4.
Okay. All right. So you feel this mobility. That's a good superficial fascia movement. Okay. So look at this. It's a little bit tight compared to this. Okay. So I'm gonna release that. Feel the tightness here. Okay. And I'm gonna go deeper to release the deep fascia restriction. Painful or it's okay?
It's okay.
Okay. Make sure you tell me. It's a little bit tight here. Definitely I feel knot in your paraspinous muscle here, here, and the other side here. So you're gonna work a little bit deeper to release those. Do you have any neck issue?
Any what?
Neck issue?
No.
Okay. How's that feel?
Okay.
Okay. So I'm trying to release deep fascia restrictions and deep scar tissue. I just don't want you to feel pain because that could cause internal inflammation.
Okay.
So that's why I need to get your feedback, so I will decrease intensity of the work. Definitely we need to work on your posture a little bit.
Yeah, posture's bad.
Yeah. Well, it's gonna be easier after releasing your mid back to correct your posture, because you're not gonna feel that pulling. Okay. That's all on your paraspines here. Feel that?
Okay. I had an osteopathic doctor last week.
Okay.
She did a cortisone shot.
In the back?
Yeah, and some dry needling on the left side.
Oh wow.
But it didn't seem to do much.
Yeah, well, cortisone shots and dry needle will not break your scar tissue or release the fascia restrictions. You have to have mechanical force to do that.
Does the stretching help at all? Or?
So think about this way. So your muscle should act like a rubber band. When it contracts and relaxes, it should stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, it does not stretch much. Okay? So stretches will not gonna break the scar tissue. It's like you pulling the band.
It's tighter. Okay.
Yes. Over stretching will cause micro tear and will cause more scar tissue. Actually, study shows you do stretching, you're causing more inflammation than if you overstretch. And if you overstretch, you injure yourself. That's why I don't give my patients stretching, because there's higher chance of injury from the stretch than benefit. So it's better to do the function training, ergonomics, body mechanics, and regular exercises than the stretching. But to break the scar tissue, it's kind of like it's a knot in the muscle. You have to have mechanical force to really release it. Like, for example, you said dry needle. That's not enough mechanical force to do anything. So I have to go like here with the A5 tool. See how deep I'm going in? I'm actually applying mechanical force here. So, and that's how we can release it. You have to get into it.
So is that more scar tissue in the muscle or scar tissue in the fascia?
Both.
Oh,
Okay, so normal healing, when you have any cut or any injury, the body builds the scar tissue. With any injury in the body, scar tissue is the glue that keeps things together. If our body does not build the scar tissue, it's open when susceptible for infection. So actually scar tissue is part of our survival. The problem when we have too much of the glue that glues things together. Because the fascia layer is interconnected with the muscle, so when you build the scar tissue, you're gonna glue both of them together. Because the fascia on the top, and you have the muscle, and you have a fascia layer inside the muscle to separate the muscle fiber. So when you have a scar tissue, it's just gonna stick everything together. So we have to work on both the fascia system and the muscle simultaneously, because the problem is they stuck together. Does that make sense?
Yep. Now, is that too much collagen production or the cause of that?
It's fibrosis.
Oh, fibrosis. Okay.
Fibrosis. It's a kind of imbalance of the body to resolve it by itself. So think about when you were like 15 years old and you get a cut and your body just scarred and it dissolved by itself. That's perfect scenario. But when we get older, this process decreases significantly. And if you add to that vitamins, mineral, hormonal imbalance, the body will not, that process will decrease significantly, because you need magnesium, you need D, you need iodine, you need C for their body to transition from inflammation stage to proliferation stage to maturation, which is the normal healing cycle. So if you don't have the cofactors, that process decrease, speed decrease significantly. Does that make sense?
Yes.
So the problem when we look at the patient, it's not only manual therapy. Some patient is stuck in a proliferation stage and just release it manually. That should be good enough. But other patient, if you have a lot of other deficiency, the tools will not gonna replace your magnesium deficiency or C or iodine or zinc or K2. So we have to really assess the whole system and figure out what is missing, you know. So this way we can influence the healing cycle to move faster. And like in the video, I didn't do a lot of nutrition, or I do the manual stuff. But after the treatment, we usually do the nutrition evaluation with the patient to make sure they are on anti-inflammatory diet. There's no deficiency that inhibit or slow down the healing. And that's part of the ASTR treatment, to look at the whole system instead of just focusing on in like a small part of the system that's ignoring the big picture.
And then how is this different than, say, like a deep tissue massage?
It's hard to target the tissue with hand.
Okay.
When you look at this, you massage therapist. So when you go deep, look at me. You use your knuckle or your elbow.
Yeah.
Okay. Look at this.
Oh, I see.
You mechanically, it's impossible to go deep with the.
Yeah.
Mechanically, totally impossible to go deep. Mechanically possible. But here's the thing: you get tired, so you're not gonna do much work.
Right.
Here, I'm using a few ounces of force.
Okay.
I'm using my body weight. I'm actually was sitting.
Oh gosh.
So mechanically, I can be more productive to get deep. So that's the difference.
Okay, that makes sense.
And the other thing for these tools, I can show you these. For the fascia, I use the superficial fascia and with this, and deeper fascia with this. You need to grip on the fascia.
Now, is this like a hard?
Rubber.
Oh, it's a rubber.
It's a medical grade rubber.
Oh, okay.
Silicone, yeah. So you see I'm gripping on this.
Uh-huh.
Can you grip with your hand? The grease in your hand gonna slide, okay? And because I have different design here, I don't know if you can see it, so it has different shape to target different layer of the fascia.
Oh, okay.
So I'm here, you feel the tightness here?
Yeah.
And I'm gonna release it.
That feels good on my shoulder.
So can you see the release now?
Uh-huh.
How much force I did?
Yeah.
Not much. But when I use my hand, it's tough on the hand. And I'm going deeper here with this tool. You feel the tightness here? That's your fascia layer. I went to deeper layer of the fascia.
Okay.
Now I can release it. See, it's just take a few seconds because I have the tool to really get to the tissue that's restricted. But with the hand, it's hard to distinguish which layer you're working on.
Okay.
Does that make sense?
Yeah.
And this one, it go a lot deeper. So that's why it's hard to be precise with the hand.
Okay. Even with like rolfing, because that's deeper too, but it's you're still using your hands
You're
to
still
do the
using
rolfing.
your hand, you still have the same issue of not getting to the tissue.
Okay.
Because you use your elbow, your knuckles, or you're using your forearm, you're not going deep enough.
Okay.
You're not grabbing the tissue.
Right.
If you're not grabbing in the fascia, you're not releasing it.
Okay.
You have to grip to it. Does that make sense?
Yes.
So that's the difference. This is for the scar tissue, and you feel she does not have a shoulder issue. I'm just showing her. You feel the knot here, and it's easy for me to really loosen this up than using my hand and just pushing on it or massage it. Does that make sense? Which one feel different? What the difference when you feel
It's
this
definitely deeper.
with the tool
Yes.
and more consistent?
Yes.
Is that so? This is more targeting treatment compared to massage. You really doing it for wellness to loosen up stuff to feel good. Does that make sense?
Yes.
So this is more targeting each tissue, and and that's the goal, to target the dysfunction. Did I answer your question?
Yes.
It was
Thank
a
you.
very long answer, yeah. I forget the question, but I answered. Yeah, I studied Ralphing before I invented these tools, and I was like,
It's a lot of work to do that.
it's a lot for the therapist,
Yeah.
and it's painful for the patient. And I'm like, when I look at the anatomy, you're not getting to all the fascia layer with your hand. It's impossible mechanically. So, and that's when I start to think about, we have to have a tool. So I looked in the market for a tool to release that. I could not find a tool. That's why we have different shapes. I have, for healthcare provider, 5 tools. Okay. I'm actually going at least inch and a half here. Okay. Definitely have a lot of inflammation here.
And that's what, liver on that side?
The liver is usually in the right, in the middle.
Middle.
Right? Yeah, but you know,
Intestines, maybe?
yeah, intestines and a little bit in the liver. Is it too much?
No. Gallbladder too. Oh, I guess it's sitting. It sits on top of the gallbladder, right?
Yeah, but you have a lot of inflammation here. We were doing nutrition, so you have gut issue to liver issue. I'm actually going in directly to that. Is it too much? Painful or it's okay?
It's okay.
Okay, so I just want to release this because I notice your posture like this. And this posture, sometimes it's from tightness in here, a lot of the time, especially if someone has surgery here. If you don't have surgery here from bad habit, all your fascia is tight here. So I want to release that so it's not pulling on your back, the opposite direction.
It could be the years of hunched over clients too.
A lot of work with you. Yep. That's just a
like
bad
with
habit.
surgeon, like where you're sitting in a chair and
I see a lot of surgeon, dentist. They have a lot of neck, back issue from their body mechanic from working. How does that feel?
It's okay.
Okay. Definitely, I'm able to go deeper. Is that too much?
Nope.
Okay, one of the common questions, how long it's going to take to break the scar tissue? Depend on two factors. One is genetic, two is your deficiency. So I had some patient in one treatment, we totally get rid of it.
Wow.
Okay. Other patient, because you need K2, you need magnesium, you need D, you need C, the body to really resolve things. So what we do, the mechanical force while we introducing the deficiency, so things will move fast.
Does it depend how long it's been there, or not really?
Could be, but it's more relevant as a deficiency because you're stuck there all because of your deficiency.
Oh, okay.
You know, you're stuck in the inflammation stage because there is not enough magnesium.
Okay.
And not enough D, zinc, or C, or B. You know what I mean? Yeah, so if it's longer, that means there's a deficiency.
Okay.
Or you did not work with someone to really know how to release the proliferation stage.
Okay.
So it's either or. And that's why I don't do anything for inflammation unless to really clear up the proliferation stages, scar tissue, fascial restrictions, to rule out. Because you said you felt 90% better. So now that's, for me, 90% your pain from proliferation stage in that spot.
Okay.
Does that make sense?
Yes.
Is this the spot?
Uh,
Or that?
yeah, a little bit.
Because I felt it more in, a little bit in here. I don't want to cause more inflammation. That's why I'm easy with doing too much manual work on this for now.
Yeah, sometimes I'll get a deep tissue massage and it just feels okay at the time, but the next day is terrible.
It's inflamed.
It's very
The problem,
inflamed.
it causes more inflammation. And if you cause more inflammation, your body has to go to proliferation stage,
Okay.
which is
Gotta
causing more
heal
scar
it.
tissue.
Okay.
Which is like, do you know if the scar tissue from the treatment going to be less than the original one? It's kind of gambling,
Right.
you know. That's why if you're gonna get tissue massage, Swedish,
Okay.
just for wellness. It's not gonna release the tightness, it's just gonna make you feel good if you wanna do it, you know, this is an option. But I don't think deep tissue massage is a good idea.
What about myofascial release or trigger point or?
Okay. Based on the study, myofascial release does not provide long term.
Okay, just temporary.
They use the elbow, they use the hand.
Okay.
It's not getting to the tissue.
Okay.
Myofascial release is not gonna break scar tissue.
Okay.
So we have to think about, it's like your car need a tune-up. Don't pick one piece like the spark plug and say, I did my tune-up.
Oh, I see.
You need to do the tune-up.
Okay.
To really improve the performance, you need to change the oil, the filter, the spark plug, everything. And that's what we do with ASTR is a biopsychosocial model. It's mean tune up everything.
Okay.
Work on the fascia, scar tissue, the trigger point, muscle spasm, posture, deficiency.
Okay.
So this way we improve our chance of success than just changing your spark plug and that did not do anything
So
to the
it's more
filter.
like a holistic approach then.
That's correct. You know, because our body is so complex, so messy, that it's never one thing that's causing the issue. It's usually a lot of issues going on at the same time. Think about our bodies like puzzle. You cannot pick and choose which part of the puzzle to use. to see the picture. You really need to put everything together.
Well, everything's all connected.
It's all connected.
Yeah.
Yeah, like, you know, I see like therapists or doctors, oh, that's a knee, that's the elbow. No, the fascia system is not the elbow. The knee muscle connected to the hip. You know, the hip connected to the back.
Yeah, I notice if my mid-back's tight, my hips are tight, my knees ache
Chain
a little
reaction.
bit more, my feet are kind of sore a lot.
Because you cannot separate them.
It just goes through the whole body.
It's like a chain. You have a tension on one side of the chain, the tension will be translated to the entire chain. So yeah, go up. Yep.
Yeah, that's pretty much gone on my mid-back. But it's
good.
I could kind of feel that the hips are a little bit tight, but
Okay, let's
that's
do
another
twisting,
thing.
lift, and back. So we worked on the back.
right.
So think about this way. We released the tight area. We did not release your hip. So your brain starts to recognize this is loose and start to comparing. It's not your pain is traveling, it's just you more comparing loose to tight.
Right.
That's a very good sign that we lose one area. So where are your tightness now?
Just yeah, I can't really tell at all in the back.
Okay. And the back is fine. Okay. Definitely need some work on your hip. Yep. So let's see how it feel.
Yeah, I can definitely go a lot farther.
You turn it more. Yep.
My range of motion is definitely better.
Extend. That's gonna help you with golfing a lot.
Yeah.
Okay. Spin forward and extend. Okay, let's do 5 down.
What's that?
5 going down.
Oh,
And
5?
Go up and just back and forth quickly. Good. How's that feel?
It's much better.
Yep.
Yeah, before I could only get to here and I was so
Yep.
tight. Now I can touch the
Touch
floor.
the floor. Okay, you can see the floor now. Okay.
Yeah, I can, my hamstrings.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.